Well, good afternoon. It's great to be here at Orlando Health. I want to thank David Strong. We've been working hand in hand with the folks here from the beginning of this, and I can tell you the way they approached it here was always very fact, data-driven. I never heard any hysteria. I never saw them panic. They followed the data, the facts, and they've been able to handle this very, very well. So I want to commend you guys, and thanks for lending your support to our task force as we go forward and look to see what the next step is for Florida. I do think it's worth pointing out how successful that Central Florida has weathered this. If you look, I remember speaking with David several weeks ago, and he said, yeah, our data shows that the cases peaked at the beginning of April, and we think the hospitalizations peaked a few days after that. And if you look at the data, you can look, hospitalizations on April 7th, total hospitalizations for Orange County, 116 hospitalizations. That's probably like 2-hour stretch in Brooklyn. So they were at April 7th, and then now, as of last night, they were down to 68 hospitalizations. And so just as they analyzed it, it peaked, it's gone down, and I think that they're going to talk a little bit more about what they're seeing on the ground with the cases. But if you take a community in this Central Florida area, you're talking millions of people, you have some of the worldwide attractions here, January, February, beginning of first 2 weeks. You have people from all over coming in here. I think a lot of people looked at that and thought that that was going to present problems. But if you look at the numbers and how the community has gone through it, I think it's been tremendous. And so hats off to you, hats off to the folks of Central Florida for doing such a good job. And really, if you look at the state of Florida, we have about 60+% of the cases in 3 counties in Southeast Florida. And you have Miami-Dade, who's close to now 40% of the total cases statewide. Southeast Florida represents about 29% of the population, but over 60% of the fatalities and hospitalizations. And so we have 16 million people in other parts of the state. And I think that the numbers, well, even in Miami and the Southeast Florida, compared to some of the other states, the per capita is still lower than elsewhere. But the rest of the state, Central Florida, if you look over in the Tampa Bay area, their numbers have been very low. That's a positive story to tell. And so they're going to be able to talk about some of the things that they did. I'm going to just give an overview on a couple things that we're going over, and then I'm going to turn it over to David and the doctors to talk about some of the things they're seeing, and then some of their insights about the way forward here for the state of Florida. So testing has been one of the most important things from the very beginning for the state's COVID-19 response. We're close to 340,000 individuals that have been tested. And in southern Florida, where we have the bulk of the cases, the ratio of tests per citizen is 1 for every 45 people. And as we're looking at the trends, if you look at what the White House put out for its guidance on kind of the next steps, they talk about looking for syndromatic symptoms and ILI. In Florida, that's been very low for the whole month. But then they also talk about how are the new cases looking, and then more importantly, what's the rate of positivity in the new cases. And the reason Dr. Birx has pointed this out, as you expand testing, you are going to find more cases, but if the percentage of people testing positive is declining, then that's a sense that the virus isn't replicating in ways that that would threaten the hospital system or some of the other things that we've been concerned about. So if you look in the state of Florida in terms of the testing, the most new Florida cases that we've had was on April 3rd. There was 1,317 new Florida cases. That day, the total number of tests that were received was 11,725. So that's a positivity rate that isn't New York level or Boston or some of these other places, but that's between 10 and 15%, right? If you look at yesterday, we had 823 new Florida cases reported out of 19,342 cases. And so the positivity rate for the new Florida cases compared to the tests that had been done on people that had not already tested positive was about 4.5%. And so that's a very low positivity rate. And that's gone down over the last several weeks. It was pretty consistently 9-10%, which is also low compared to where many other parts of the country. But then it creeped into 7, 8, and then the last few days it's been 6, and 5. And so that is a good sign when you see a declining positivity rate. But we really believe in Florida that trying to expand testing as much as possible is something that's very, very important. We have 7 drive-through sites, including one at the Orange County Convention Center. We've had National Guard leading the charge on all of those. So they've done close to 80,000 tests just on those 7 drive-through sites. And that's an easy way for people to be able to get tested. Fortunately, in many of those sites, our capacity to test exceeds the demand for the testing. And I think that that's a good thing. We saw this first in Northeast Florida in Jacksonville, where the first couple days, we had about 250 people a day. Then it started dropping off. And so then they expanded the criteria for people to come in. You started to see more, and then it went, and then they were saying people come. And but the demand has been relatively tepid. But that's a good sign, because that means a lot of people are not necessarily symptomatic. At these sites, anyone with coronavirus symptoms can go, doesn't matter your age, any healthcare worker, first responder, and then anybody that's asymptomatic but has reason to believe they may have been in close contact with someone who's tested positive for COVID-19 can also do it. And so that, I think, is a broad net, and obviously the hospital here is doing it. All the hospitals are doing a lot of testing. There's now the rapid test that we help with Abbott Labs get down here. There's other types of tests that have been innovated, so we want to continue to do that. But one of the things we noticed with the drive-through sites is not everyone necessarily has access to that. Not everyone owns a car. I know Florida is very car-centric, but not everyone does. So we first went into a public housing project in Jacksonville in conjunction with the University of Florida. We supplied the swabs and the testing kits, and they went in, and it was a walk-up concept where they would walk into a neighborhood, people could walk up, they could do testing, and these are underserved areas where some of these tests may have gone undetected, the positive cases. So we've taken that model and now have 6 different walk-up sites, various parts of Florida, including here in Orlando. We also have it in Broward, Palm Beach, Tampa, and Miami. And so they've done, just in the past week, we've done 4,700 tests in underserved areas where we're offensively going into communities, proactively getting people tested. We also have, one of the things from the very beginning that was clear with the coronavirus was that not all age groups were equally at risk. And I didn't necessarily take anything coming out of China with a grain of I took everything out of China with a grain of salt, but I did look at the South Korea numbers, which I believe were credible, and it was overwhelmingly. The fatalities were occurring in folks 65 and up overwhelmingly. Not very few under 30. I think South Korea may not have had any at the time. And so we knew where the risk was. And so very early, we acted to protect the nursing homes and the long-term care facilities. We required all staff to be screened for fever, for coronavirus symptoms, and if they had been in contact with anyone who had traveled internationally or been in a place where there had been community spread. We banned visitors from going in on the outside. We required the wearing of masks and other types of PPE. And then what happens is, if there's an outbreak or there's an incident, we have these response teams with the Department of Health and ACA that will go in and try to contain the outbreak. And so they've been on sites. They've made thousands of visits to these types of facilities, which is very, very significant. But what we were finding was, and the results I think have been good. Florida is ground zero for the nursing home. I mean, we're God's waiting room. We have a huge number of facilities, a huge number of residents. But because of the proactivity that we did, if you look at Florida compared to other states, and you look at fatalities connected to long-term care facilities, New York, per 100,000 residents, if you put it apples to apples, New Jersey has 23 fatalities in nursing homes per 100,000. New York, 18. Massachusetts, 17.5. Connecticut, 10.5. Louisiana, 10. Pennsylvania, 6.6. Florida has 1.2 fatalities per 100,000 in those long-term care facilities because there was clearly a risk there and there have been a lot of resources expended. But what we found was some of the cases in these facilities were because the facilities didn't follow the regulations. Workers who were sick were allowed access. They ended up spreading to staff and to residents, and you ended up having cases there. But there were also instances in which there was no evidence that any of the staff were sick initially. And this is an asymptomatic spreader, let's say. They go in, and in Suwannee County, you had like 40 staff that got infected at a nursing home. So we tried to figure out, okay, you can screen, but if there's nothing to screen, then what are you going to do? So we've created, and they've been going at this now for several weeks, 50 National Guard strike teams, 4-man teams. They affirmatively go into these facilities, particularly ones that we may feel are at risk, and they will test staff, they will test residents to try to see if there's an outbreak, and then if there is an outbreak, prevent it. We also have a lot of the hospitals that have worked with these facilities because it's obviously in the hospital's interest that you don't see a major outbreak because a lot of those folks would end up coming into the hospital. So we've had hospitals working as well with this, but this is very, very important given the numbers and given how at risk these facilities are. So I think that the Florida model has been good. We're going to continue to look for ways that you can make it even better. I think as you have more point of care testing and that becomes more widely available, that gives you a lot of options. Also, seroprevalence studies and antibody testing. If you're working at a nursing home and you have the antibodies, well, you're definitely less risk to the residents. So that's very important to know. People that work in these hospitals, if they have the antibodies, nurses, doctors, that's very important to know. It's also important to know the prevalence of the antibodies throughout society because that allows us to determine what's the true hospitalization rate for people that get infected, what's the true infection fatality rate for people that get infected. The Miami study that was done suggests that many, many more people have it than have actually tested positive for that, which would mean the fatality rate is much lower and the hospitalization rate is much lower because you've had many more people, many of whom don't even know they had it when we're asymptomatic. So those seroprevalence tests and the antibody tests, we're getting our first shipment on May 1st. We've had the one that's FDA approved stuck in China for 2 weeks. They sent one shipment to New York. They haven't been able to get any more out of China. We'd like to get those in too. But some of the things we'll do, we'll use them in nursing homes. We'll help the hospitals with them. We'll try to figure out in different parts of Florida how widespread are these antibodies. Stanford did Santa Clara County, California, and they said it was 50 to 85 times more prevalent in the community, the antibodies, than the number of people that had actually tested positive. That's critical information to know as we move forward. We also, and even though at our drive-through test sites, the supply exceeds the demand for now, we do think it's important to have as robust testing as possible. One of the problems that we ran into during this time is the use of these private labs. We were promised a 48-hour turnaround, but what would happen is, and look, a lot of this isn't even being sent from the state, doctors' offices, other places, but these places were overwhelmed. And so all of a sudden, sometimes we would get test results reported to the state. Some of them would be 7, 8, 9 days before. That makes it hard. If you're a business owner and you have somebody that has symptoms, they get tested, you got to wait 8 days before you know whether that person can go back to work. If you're in a hospital situation, now they have labs here, but people are going to need to know this quicker. So we have contracted with 2 of these high throughput labs. What happened was when this first started, the reimbursement from Medicare and Medicaid by the federal government and HHS was $50 a test. So there was a lot of lab capacity where it wasn't economical to bring that online for coronavirus testing. When they increased it to $100, that then made it economical. So you've expanded lab capacity probably in the last week or two as the president's task force has been really insistent on this. And so we now have 2 different labs that are under contract. They will be able to process 18,000 samples a day. And we hope on a 24-hour turnaround, but I tell people, knowing this business, probably 48. But still, that's a high volume, and hopefully you get relatively quick results. And so that's 18,000 above and beyond everything we're doing right now. But we also are we have 3 state labs. And when the HHS did the test, they sent tests to all the state labs. We had capacity in Florida, and all 3 labs combined to do 900 samples a day. And when you're only testing 500 people a day, maybe that was fine. But when you're testing 20,000 people, maybe we'll do even more soon, you're going to need more than that. So we have ordered additional PCR testing machines to arrive at the state labs on May 25th. If those come in and they're set up and everything's good, well, we would want by the summer to be able to do an additional 10,000 samples a day on top of the 18, on top of everything the hospitals are doing, point of care testing, and there's new things coming online where people can test in their home and then mail it in. So there's going to be a whole bunch of options. So that will dramatically increase our capacity. Again, the demand has not exceeded the capacity in Florida for quite some time now, and that's a good thing, but we think you need to be proactive on this. I've also ordered the Surgeon General to allow licensed pharmacists in Florida to be able to order and to administer COVID-19 tests. That may be a more convenient way for a lot of people in the state of Florida to be able to get a test, and so shouldn't they have that option to do it? We think that that's a good thing. And our antibody tests, when they come in, we plan on starting that right at the beginning of May. So I don't want those things sitting around. I want to get them out. We want to know who has the antibodies. When you look at this, you're seeing now Northern California had a death at the beginning of February. They went back, they checked, and it was positive for COVID-19. People had thought that it really wasn't even in the country at that time, that it didn't get here till later. But I think it's pretty clear that this thing was here earlier than we thought, and we need to know how early it was. But testing for these antibodies, I've had people tell me, I had a really nasty illness. I had the chills. I didn't know what it was. I tested negative for the flu second week of February, and I just don't know. I'd like to get an antibody test. So we're going to be able to offer that for folks, and I think that that'll be a very good thing. One more point on the long-term care facilities. When we required the PPE because we thought it was important, one of the things we did was we put our money where our mouth is. We have sent huge amounts of supplies to the long-term care facilities. And so, since the beginning of this crisis, the Division of Emergency Management has sent nearly 7 million masks just to long-term care facilities and nursing homes, almost 1 million gloves just to long-term care facilities and nursing homes, more than 500,000 face shields, and 160,000 gowns. And so that is really putting your money where your mouth is. It's putting resources to protect those who are the most vulnerable from COVID-19. And I think that that's been, the Department of Emergency Management has done a really, really good job doing that. So that's a brief update. I want to turn it over to David. If anyone has any questions or additional information, one way you can do that is go to if you text FL COVID-19 to 888-777. We put out updates, FL COVID-19 to 888-777. You can do it. But let me turn it over to David. And can you just give us kind of your 50,000-foot view about where we stand in Central Florida, what you've seen, and what you think going forward, and then we'll have the physicians chime in.
Sure. Thank you, Governor. And before I start, let me just thank you for your leadership and your decisions, your chief of staff, really all your staff, the Secretary of Health. They've done a wonderful job. I mean, your communication with me as well as to others across the state has been outstanding. So
Thanks.
Thank you for that. I also want to introduce the folks that are up here real quick. First of all, Dr. Jamel Hakeem. Dr. Hakeem is the Chief Operating Officer of Orlando Health. He's also a practicing anesthesiologist. And this morning, he was at Orlando Health Winnie Palmer Hospital helping deliver babies, something that has kept going throughout the pandemic. Next to me is Dr. Sunil Desai. Dr. Desai is the president of the Orlando Health Physician Group, and so all of the physicians across Orlando Health report up through Sunil. He also is a practicing intensivist. What that means is that he works in the ICU, and so Sunil cares for patients that are positive with COVID-19 or those that are rule out as well. And then finally on the end is Dr. George Rawls. Dr. Rawls is the Chief Quality Officer for Orlando Health. Dr. Rawls is a practicing emergency department physician, and so he is someone on the front lines that when patients come in with suspected or confirmed COVID-19, he is the one that cares for them. And so we thought having people that are really on the front lines might be valuable. And then also I want to recognize Mark Jones, who's in the back of the room. He is the president of this hospital, which is Orlando Regional Medical Center, which is the busiest trauma center in the state of Florida. It's also the facility that became nationally and internationally known for their amazing response to the Pulse tragedy in June of 2016. And so thank you, Mark. So Governor, to answer your question, to give some context on more micro level, Orlando Health has about 2,400 beds across our system, hospital beds. Our normal census on a day like today would be about 2,100. This morning, the census was 1,300. And so it gives you a perspective of what the normal census was at 2,100 to 1,300 this morning. As far as directly related to COVID-19, our high was April 8th with 54 patients. So across that 2,400 beds, the high was April 8th at 54 patients. This morning, that number is 13 inpatients. If you want to drop down to those individuals on ventilator, the highest ventilators number that we had was 26, and this morning that's 6. So certainly the peak, we believe, has passed. If you look at our primary region, which is a 4-county area, 2.6 million population, that high of new cases was April 1st at 146. So April 1st, at least to date, was the highest at 146 new cases. Yesterday, for that same MSA, the 4-county area, the 2.6 million population area, was 21 new cases. And so again, if you look at that trending, the trending follows that really that peak was around the first and second week of April. So one of the things that I would like to do is actually ask a couple of the doctors if they would comment on just their experience with caring for COVID-19 patients and the process. And so maybe start with information about testing and how our own testing was developed, and then maybe some of the novel therapies and how those are working, but also how we need to be careful about those.
Before we do, just is the curve flat in Central Florida?
Right now, the curve's still going down.
Yeah, so.
So thanks, David. I'd like to also, just before I make any comments, thank the governor, his entire team, the secretary. It's an honor and a privilege to serve, so very much appreciate including myself and the team and my colleagues next to me as well. So talking about the experience of taking care or going into a patient that is suspected to have COVID-19. Suffice it to say, we have a phenomenal group of intensivists here. Early on, we were not lacking for anything. We had all of the equipment, personal protective equipment, the ICU beds, the ventilators that we needed, and I am surrounded by some of the best physicians in all of Florida. So I'll say that at the outset. The second thing I wanted to add is, as far as the testing goes, and I'll let some of my physician colleagues on the left comment more in detail, but that was a true game changer for Central Florida. The team at ORMC, our pathologists, under the direction of Mark Jones, really developed internal capabilities long before commercial testing was available, and that really helped us identify the patients up front and really allowed us to manage our supply of PPE. Realize that it's not the elective surgeries that chew up the PPEs. It is the fact that you're going into a room where these patients are isolated, 50, 60 times a day with the various team members, and you burn through the PPE. So knowing if someone's positive or not is extremely important for resource utilization. It doesn't really change management. Our management would be the same. So I'd make that. And I'll let others comment on the level or the amount of testing we had and how that was developed. I would like to add that the therapies that we utilized in treating the COVID patients that David just alluded to included conventional therapies, especially for those who are very sick. That includes being intubated, being on ventilators. Couple of things, it's gotten a lot of press, but the one edict, if you take anything away, is let the data drive the decision making at all facets. That includes whether it's epidemiological or if it's experimental therapies. There is no known cure or magic bullet for COVID-19. Having said that, there are small anecdotal reports of either chloroquine used with an antibiotic, for example. But again, unless it's in the purview of the individual physician and that patient making the decision, that physician or that physician's family making the decision, it's considered experimental. And as we now have seen, there are a fair amount of side effects with chloroquine, so we just have to be very judicious with what we use. I would also like to say this, very proud to be associated with Orlando Health. To my knowledge, I believe we're the first in the state to use convalescent plasma as well. And there's more to come on that therapy, and that's where we're
Can you explain what that entails?
Convalescent plasma is taking the plasma or the fluid, taking blood out of a patient who has suffered from COVID-19, whom we know to be positive, who has followed certain criteria and they're now negative, taking that, processing the antibodies, or the serum, if you will, and then making sure it's compatible with the patient that we intend to administer it to. And when we give it to that patient, we essentially are boosting their immune system to help fight this infection. The two patients that I'm aware of that I believe we've given, possibly by yesterday, 6 patients or so. The two that I was, my colleagues that I have knowledge of did have dramatic improvement with convalescent plasma. So this is something that's, we've partnered with our blood banking partners and are going to continue to use this. This is going to be a huge game changer in our armamentarium to fight COVID-19.
And we're just the state. I've had the Department of Health working with OneBlood as they get blood donations, testing for antibodies, and then obviously making those available to healthcare providers. And if you are somebody that's recovered from COVID-19, people should know that by you donating blood, medical professionals can actually use those antibodies, and it really seems encouraging about what's happening.
One thing I wanted to add, we are, for every patient that we've tested positive, even if they've never made it, and we're fortunate enough, knock wood, not to be sick enough, but we have sent them a letter. We are asking them to donate plasma. So
thanks for that update, Dr. Desai, and thank you, Governor, for allowing us this time in front of the communities to give some reassurance to the communities that it's safe and that this is ramping down and that all of the actions that you've asked us to take and that we've all taken to protect the communities are actually working. I am a little humored and I get heartened by hearing you talk about seroprevalence studies and antibody studies, because I'm comfortable that our governor knows the science behind some of this stuff, and it makes me chuckle a little bit as a physician.
If you only knew. I can tell you about NIH studies from the pandemic of 1918, 57, 68, but I think you need to do that because we're in a situation where a lot of this stuff has never been tried before, the way that the country has done it. Some of it has, but some of this other stuff hasn't. So, I feel like looking at historical experience, seeing things that may have worked or not, and then obviously really keeping up with this. I've had more discussions with the commissioner of the FDA in the last 6 weeks than I've done my whole life, and I was in Congress for 6 years. We are constantly, I'm talking to the major manufacturers, CEO of Abbott Labs, all these other places about all the newest technology coming in. All I can say is it's an interesting world, and you guys do it all very well. So thank you. I'm glad you're there.
And Dr. Desai, I just received a text that we have given our 12th unit of plasma now. So 12 patients have received convalescent plasma since we started the program 2 weeks ago. And as David Strong mentioned, I was working over at Winnie Palmer Hospital, our Women and Babies Hospital, just before I walked over to the press conference. And, that team over there, hasn't stopped. There are some things we do in the health system that haven't had the benefit to slow down. And delivering babies, we deliver about 40 babies a day over there. And our neonatal ICU is still at capacity, and we're still running at full bore for the deliveries over there. We're still at a level 1 trauma center in the middle of all this. Our cancer center is still running at full speed. We still have to be an ICU for all of the critically ill patients that aren't COVID positive that would normally be in our health system. So, it's a challenge for health systems, and not just ours, to deal with this new thing that none of us have had before and still be there for the communities and do the things that we're supposed to be doing at the same time. So I'm pretty proud. I'm certain that the team members over at Winnie Palmer Hospital right now are so busy they're not even able to watch this press conference. So, but we've done a lot of great things to really prepare. We're very fortunate that we haven't had a surge here, but we are well prepared. We prepared, and we were given the gift of time to prepare, and we've drilled and we've practiced, and we're ready for volumes 20 times more than what we've actually received. And we're very thankful through a lot of behavior modification in the public that we haven't had to have that have that surge. We've done the universal masking that a lot of organizations have done. We've done the universal screening that a lot of the organizations have done. We have visitor limitations like everybody else. We have cohorting of patients in units, so patients who don't have COVID and are in the hospital for something else aren't exposed to those patients and aren't exposed to the team members who are caring for those patients who have COVID. So we've done all those things. We've instituted recently testing of pre-surgical patients for COVID-19. The great news is since last Wednesday, since we started this, no pre-surgical patients who were asymptomatic have actually tested positive for COVID-19. We also started a study at...
How many people do you think that you tested?
We've tested over 250 pre-surgical patients since last Wednesday. And interestingly, we also started a study for the women who are coming in to have babies at Winnie Palmer Hospital last week too, and we're testing all of them as they come in the doors. And out of about 150 some tests so far, not one has tested positive if they're asymptomatic. So it's interesting data that we're coming up with as we have the luxury of to be able to study some things. And it's a little different data than what we might have heard out there coming from other places. So we're happy to see the prevalence of incidental COVID-19 in an asymptomatic patient just hasn't shown so far. So, this is one more thing. I want to talk the high level about this disease. It's, as you talked to us earlier, this is really a disease like a tale of two cities. It's a disease of the elderly and the sick, and it's a disease of everybody else. And it's totally different disease for those two populations. If you're elderly or you have chronic conditions, this is a horrible disease. And if you're healthy and on the younger side of things, this is a relatively inconsequential disease. There's still patients who get it, but the denominator is so large and the numerator is so small that the message we should be sending is we really, really need to protect the chronically ill and the elderly from this. And I think that we've done a lot of things and modified a lot of behaviors in that regard. So I'll stop there.
Great. Well, thanks a lot. I appreciate it. My wife and I, we had a baby during this period, and it was, they're still working and people are still doing it. It's a very surreal experience I'm literally in the hospital. My wife's in there. I'm talking to the President of the United States about what we need in Florida. Go in, have the baby. I'm holding the baby, and then an hour, 2 hours later, I'm back, back working on this. And we've really not been able to have family time yet for it, but I know a lot of folks have been in the same boat. So, but I appreciate you guys being on there because we lived through it, and folks have been so great throughout Florida.
I wonder if Dr. Rawls could speak about maybe some of the unintended consequences of folks who have needed care but yet may have delayed that.
Absolutely. Thank you, Governor. Thank you, David. There's one thing I'd like to really emphasize here is that we have been able to maintain the critical services online throughout this entire event. We've not stopped taking care of the serious trauma cases. We've not stopped taking care of stroke patients, not other patients with emergencies or really urgent medical needs. But there are some other critical things that are not coming through the EDs now, that are not coming into the hospitals, that we really are concerned about. And I will say, to some degree, concerned enough about to say this is an upcoming surge of itself, really a surge of unmet medical needs. And it's time for the community to understand that the numbers support this being the time to come back and get your health care. You need to come back and take care of yourself. Our doors are open. Our hospitals across Central Florida are safe. There are many cases that we've seen come into the emergency departments that were much, much worse than they would have been had they come in a few days before. We've had patients who ignored chest pain for days and came in a cardiac arrest. We've had patients who ignored seizures and came in with much more severe situations. So that's really the most critical message I can give you from watching not just what's happening on the front line in the emergency department, but also looking at the numbers and understanding where we are in the community, in the state, and in the country in terms of the trend. It is time to come back and get your health care. And we're here and we're open and we are safe. So please take that message to heart.
So, well, first of all, just thank you all for taking the time to do this. Thank you what you've been doing, not just over the past 2 months, but really your whole careers. Just from someone running a hospital, we obviously went in as a country with a lot of mitigation measures. There was a fear that as the infections spike, it would overwhelm the system. Obviously, that hasn't happened. Miami-Dade County, almost 40% of the cases in the state of Florida. Do you know how much available ICU beds they had as of last night? 41% of their ICU beds are unused. And that's in the place that has the lion's share of the cases for our entire state. And I think obviously you've seen similar. David went through the numbers of how low they've been here. Hillsborough County at last night's report, that's a big county. They had a total of 35 COVID-related patients countywide. And so that mission, I think, has been accomplished. And so I guess the question is going forward to the next phase, will you guys as a healthcare system be prepared, to deal with whatever comes down the pike?
Yeah, the answer is yes, we are prepared. And you heard some of the actions that have been taken by Dr. Hakeem and others, and especially what Dr. Rawls said. Right now, we're more concerned about those that are not seeking care because of the unintended consequences that are occurring. And frankly, things that could have been taken care of easily here, by waiting, they become much more complex problems for the patient and harder to deal with.
Sure. So Dr. Desai, just as you've been on it helping our task force, really appreciate that. And what we're looking to do with some of that is there's a lot of people that have a lot of questions. They may be in this business or that. What can I do? What can I do? And basically, we have people like Dr. Desai working. The job is whatever you do, we would want you to do it, but can you do it in a way that minimizes risk? And I think a lot of businesses have already done that who were, quote, deemed essential. You've got some major companies in Florida that went to 90% telework. And I've talked to some of these executives, they haven't really missed a beat. So there's definitely ways to innovate. So understanding that framework, from a medical perspective, do you see a pathway for Florida to move to the next phase in a way that would be safe and effective?
Absolutely. In fact, we are not only think it's the right time to open up our doors are never closed. Okay, so as Dr. Rawls mentioned, it is, I think, something that you said earlier. Who's at risk? And the data has shown us who's at risk. And as we ease some of these restrictions, the health system is overwhelmingly prepared with equipment, beds, staffing. So I am 100% confident that we can handle the patients that we've put off, and I will use the term loosely, elective surgeries. The one caveat I want to say, and this is a little pet peeve of mine about elective, it's elective when you set up the time. That's the only thing that makes it elective.
I agree.
To that patient or that family, it is not elective. It was something that was prepared for, it was something, but to come to the point, we're ready, we're going to do it safely, We have a whole host of initiatives. There's a document I'm looking at with 20 bullet points that has donning and doffing, training, teaching people about hand hygiene. All of those things are in place, so I think we can definitely reopen safely.
Doc, would you mind, one of the things that I think is important is for the community to understand the importance and the dangers of a mask.
So, absolutely. It seems intuitive when people say you should universally mask. The first thing it's intuitive that we know how to use a mask. That's the piece that David is alluding to, and I'm going to get to that. It is more important, and let me stress, and I think my physician colleagues will agree, hand hygiene, hand hygiene, hand hygiene. Number one, and number two, don't touch your face after you touch surfaces. Then the masking. When you really get down to it, especially when we're in the hospital, we're trained to do this, but the vast majority of the public doesn't realize if you touch the mask in the center, how do you take off the mask? Where do you lay down the mask? If your hands aren't clean, that mask is worthless. So the analogy that I've used in the past is that mask is a power tool, and power tools come with manuals. These masks, it's intuitive on how to put it on, but we haven't trained people to appropriately take it off, touching the strings only, not touching the center of it, and how it's stored, and how long should you use it, how should you launder it. So use it. It is more important, suffice it to, I'll get off my soapbox, which is, suffice it to say, your hand hygiene and not touching your face, and the social distancing when it's judiciously applied, particularly in high-risk groups, is the most important.
Can you talk, David, about how you guys are working with businesses in the community so that as more people get back to work, that they're doing that in a way that is reducing risk and that is as safe as possible?
Yeah, thank you, Governor. So one of the things that Orlando Health has developed is a task force to work with businesses across Central Florida to help them get back to work as quickly as possible, but as safely as possible. And so there are so many questions that businesses have really across the country of how do I open up? How do I do that safely? Should I mask my staff? Should I not? What is important? What's not? And so Orlando Health has a team of people that works with businesses to help them look at their individual situation and then determine what is the right way, the best way to open incrementally, that is safe over time. And so that we believe that that's our responsibility. We believe that if this community, that if we're going to come back the way we need to, the community is going to come back as well. So we're here to support the business. And that team that I referenced is led by one of our hospital presidents as well as one of our chief medical officers from one of the hospitals.
Great.
So one of the things that we've seen out there in the community with businesses trying to protect their employees, they've asked them to wear masks, but like Dr. Desai said, they haven't really been taught how to wear the mask. And so an employee at a fast food restaurant is wearing the mask, is touching the mask and then touching food or touching other things, thinking that they're protected, but the mask is there to protect others. And if you're touching the mask, if you haven't been instructed how to do that well, you're not supposed to touch your mask unless you have clean hands, and then you're supposed to wash your hands after you touch your mask as well. So we have an obligation as healthcare providers to make sure if the community is going to mask up, that we teach them what's safe and what's not safe in terms of how the mask goes.
Any closing thoughts or advice as we move forward? Are you agree that the peak's passed here, that we need to be obviously safe and methodical, but there's a safe way back to starting to get on a next chapter here?
Absolutely agree, sir. I just add one other thing. I think it's also encouraging to see the responsibility that we've seen in the general public and the community. Everybody's doing the right thing. I see that myself in my personal life. I see it at work. I think the messages have gotten across, and there's no doubt in my mind that as we move forward back towards our normal life, that the right type of behaviors and decisions are going to be made by the community.
Great. Any other final parting shots? All right, well, we really appreciate what you guys have been doing here. Really thank the Central Florida community for their great work, and we're appreciate all the people throughout Florida, but particularly Central Florida, who've been helping advise us on our task force. So with that, I'm happy to take some questions.
Governor, 2 questions about unemployment.
I'll answer that, but why don't we do something more on topic first? Yep.
Well, actually, I'm right in line with unemployment.
All right, I'll get it, but do you have anything on this?
Given the decline in cases, are you more comfortable with reopening closer to the end of either the essential services order or the end of the public health emergency? And are you willing to commit to a deadline in making that decision?
So we're going to do everything in a very smart, methodical, safe way. I'm less concerned about a specific date than I am about getting it right. We have all kind of great stuff that have been done on this task force. I'm going to go back to Tallahassee. I'm going to pour through more of it, and then we're going to look, and then we are going to be very much looking at this White House roadmap as you look at the different phases. And I think the way to think about it is, if you go back to the middle of March and you see how how fearful a lot of people were, there was really a hysteria in the country about this, and it was a novel thing. People didn't necessarily know, and so a lot of people were really fearful. I would say more so than after 9/11, more so than after the financial crisis. And so as we've now kind of come in Central Florida on the other side of it, look, it's not easy. There have been people that have been infected and gotten sick. There have been people in the hospital. Unfortunately, there have been people that have passed away. Not nearly as many here as I think a lot of people predicted, but that's just the reality. So I think the thing is, as you go forward, are you doing that in a way that's safe, smart, a step-by-step phased approach? It's not turning on a light switch and all of a sudden we're back to February 1st. It's just not the way it's going to work, because some of this is about what we're doing, obviously in conjunction with people that know health. We're obviously consulting with people who are involved in the economy, but it's also about confidence. I mean, people need to have confidence that we're going in a good direction. And I'm glad that they were able to talk about what's happened in Central Florida, because if you go back 6 weeks, the people saying that Florida was going to be another New York or another Italy and all that, those have all been proven to be false. Florida's performed better than anyone predicted. This has not been easy. There's been taken a lot of effort, but I think people should be comforted in knowing that all these predictions of hundreds of thousands of people hospitalized were not accurate, and that's just not been the case. So that's a good thing, and I think people can be comforted by that all the stuff we heard, just really hasn't come to pass the way they was put out.
Governor, can you explain, Jerry Aston, CBS Orlando here, News 6, can you explain the process of what reopening will look like, the new norm? And we don't have an estimation on when that will happen?
Well, we're going to make an announcement pretty soon, obviously. I mean, because we're coming up at the end of the month, and we're going to do it. But I think you look at kind of the guidelines the White House has put out. I think that that's a pretty good roadmap. And I think we just want to make sure that we're doing it in a way that's smart and that factors in folks who are advising us, like Dr. Desai from a medical perspective, David Strong from a hospital perspective, and then doing it in a very judicious way. But as I've said many times, I'd rather do it smartly and safely and methodically than and part of it too, with the confidence is, even if you could flip the switch, if people don't have confidence, then the economy's not going to just take off. That's just not the way it works. And so I think we all understand that.
Governor, when you started, you said that statewide, you tested about 340,000 people. Are retests included in that number?
Yeah, so they are. It's a good question. So what happens is, and so that's one of the reasons, if you look at this Department of Health report that we put out, the second page, they have new Florida cases, total tests, positive percent. But what I had them do is say, okay, when people get tested positive, they're in isolation for 14 days. In order to go back to work here at this hospital, you need 2 negative tests. And so those are included in the total number of tests there. So what we've done is we have taken the new positives divided by the new test takers, people that have not tested positive previously, and that's how we're getting the percentages at the bottom. So yes, it does include that, because what happens is you'll have healthcare workers Some of them don't ever test positive, but some have been tested multiple times because they may have had an exposure. So it's not unique individuals, it's total tests. When we now do that percentage at the bottom of the page to see what's the percentage of new positives, that is only the people that have never tested positive before, because that really is the best way to identify a trend of how it's spreading or not spreading to the community. If you have a situation where you have somebody that's in isolation and they test positive 3 more times on day 14, 15, 16, that's not really telling us that the disease is spreading, because we already knew this person had it. So that's why that bottom portion was done.
But Governor, that number is not listed, the number of retests is not listed on the state's dashboard.
Well, so the way it would work is, the way you'd have to do it is, no, it's not misleading, because
The number of retests.
it's not misleading, because what you understand, the labs report, they dump the results to the Department of Health. So what Department of Health does is they put it on the dashboard immediately so that people have the information. If they had to parse out of 20,000 test results that get dumped in their lap, who had tested previously, it would take them probably 48 hours to be able to put the results up. So the results are put up immediately so that people have access. On this second page, if you look, it says, it explains how some people are retesting, and so it does that. But that's just the way it is. If LabCorp sends in 5,000 test results, LabCorp does not distinguish between someone who's never had a test or someone who tested positive and then tested negative twice. It's just not the way it's done. So we feel getting the information out, explaining how it's done on the second page probably makes the most sense.
When the public sees 340,000 on a dashboard, it would appear that that's 340,000 people.
Well, no, it says number of tests. I mean, that's what if you look on there, it says total tested, 345. And actually, what we can do is, I'm going to see if they can parse it a little bit more but that's one of the things. If you look at the percentage positive, if you include all the tests, it's actually not as it's higher than if you only have the fresh test. So I want just the fresh test. I think that's better. All right, we'll do unemployment.
Governor, if I can ask about unemployment.
Sure.
Thousands of Florida families have already gone more than a month without benefits because they filed in March and their applications are not being processed, while families who applied in April are getting benefits. So why is DEO not proactively?
I don't think that,
reaching out?
Yeah, so let me, so here's what we've done as of Friday night. There's now been 267,000 payments, or over 267,000 payments that have been sent out. So that's money in the bank, either check in the mail, direct deposit, debit card, done. And just to put that into context, we only had about 300 and some thousand all of last year. So this was a system that was not designed for this. We've done a lot of engineering work, still doing more work on it to be able to do it. So that is being done. It's also important for people to understand that normally, if you were unemployed, you would have to wait. You'd have to look for jobs. You'd have to do all that. We waived all of that. So in a typical thing, even if there was no problems with the system, you're looking at least 4 weeks. And so we're trying to streamline it. I've cleared as many hurdles as I legally am allowed to do. Made huge changes to this. Look, this thing that was done, I mean, this was before I was governor, but they spent $77 million on something that is really, really a flawed product. And so it's required a lot of 24/7 technical work to be able to get. So this weekend, they're working hard to process things that have been held up. And I hope to have a fresh announcement on Monday about what it was. I will say this, though, just so people understand. The number of applications that are submitted that DEO posts on the website, not all of those folks have qualified for unemployment, because you obviously had to have been working and then lost your job. And so they're going to start making clear some of the folks didn't make it through that process. There is some other federal money that's available. They will be directed for that. So as you start to see more of the claims paid, which you're going to see more of, and hope to have a good report on Monday, and then just factor out that some of the people that applied just weren't working or don't meet the criteria. So that's what it is. Another issue that they had run into is this stuff is not just like the state does it. Like the state has to check against federal Social Security, interstate wages, and those require running through a federal database. And so Social Security was running at I think like 1,000 a day to verify the Social Security numbers. Well, obviously, that would take till August to process these. So we've worked proactively to be able to troubleshoot that component as well. And so that's why they've gotten to the 267. We have a lot in the hopper, and my hope is that I'll be able to do kind of a nice rundown of everything on Monday about the progress that's been made this weekend. But people should know it's been the administration's #1 non-health priority for several weeks with this rebuild of the system. You have a very clunky system that has actually been re-engineered. If I would have just said, let's build a new one, it would have taken 6 months. So we had to work with what's there, had to make some serious architectural changes. And that's basically been going on 24/7. And not only that, I got 2,200 state employees from other agencies who don't do anything with unemployment. And we've entered them into, drafted them into helping process the unemployment. So we have had folks process over 100,000. So that's the initial, maybe a paper application, they put it in, and then it gets ready to be run through. But that has saved a huge amount of time to be able to do that. And we're going to continue to update the dashboard with that. We also have a requirement that people every 2 weeks recertify that they're still looking for a job, and we were able to waive that because that is another roadblock. And we've also waived continuing to search for job requirement because we understand it's a difficult situation. There's not exactly major amount of jobs available. So there have been huge roadblocks cleared. The system is performing better. It's not 100% where we need it to be. But I think this weekend we'll have some more good news. I'm hoping to be able to announce some stuff on Monday.
What would you say to the people who have applied and they're getting the pending or active status, or the independent contractors who filed an application, they've been rejected?
Well, they're
not
right.
eligible for state, but maybe eligible for federal.
Right.
Big picture, what would you say to these folks who are scared? They can't pay their bills, and they just want some daily reassurances from the state, and they're worried that they're going to fall through the cracks?
Well, so they can be reassured that there's never been more manpower devoted to a single economic problem, certainly since I've been governor, but I'll bet you in the state's history, than what's being done right here. To take 2,200 employees from other agencies, get all hands on deck, to be doing major architectural changes to a really bad system. I mean, this system would normally process 1,000 claims in a day. That'd be like a good day for them. So now you have a crush where you're having hundreds of thousands of people apply. And so this has been done 24/7. We have people working on it. I don't think we've probably ever had an agency work as hard on a single problem in terms of man hours that people are putting in. Now, I had to make a change at the leadership. So I have Jonathan Satter, Secretary DMS, and he's there every day pushing to get checks out. That's the #1 thing we're looking to do. Now, this is taxpayer money, and so if someone sends an application, there needs to be a way to process it. And that's what he's working on. But 267,000 now. I know they've done more this weekend. We are going to have a good report, hopefully on Monday, to be able to do it. But just people should understand that this has been a tsunami that this system was not built for. And look, this system is a bad system, and it was overpriced. And I don't know why they paid that much money for it. But I would also say, even if you built a perfect system, 6 months ago, no one would sit down and say, well, you should maybe plan on the economy just voluntarily ceasing. That's just not something that would have been. So we understood the Great Recession's here, this is here, and so these changes have been made. We brought in, the state brought in 100 new servers to be able to expand the capacity with this system, and have done many other things to be able to do it. So it's a huge priority for the state of Florida, because I understand personally, if I used to work paycheck to paycheck. I mean, I didn't have 2 nickels to rub together until I got out of the military. And at the end of the day, when you're working paycheck to paycheck, and this suddenly you suddenly get laid off, it's tough, especially if you have bills to pay, especially if you have kids, and especially if you don't know what's going to happen 2 weeks, 4 weeks down the road. So we understand that, and that's why we've moved heaven and earth to be able to get these checks out. I think when all is said and done, when we really document and let people know the extent of things that had to be done to get there, I think people will be really surprised at the level of manpower that this took. But I think they'll be glad that it was done, and so we're continuing to work every day.
Deanna Halburn from WFTV.
Executive order.
So,
Why don't you go right here?
yeah, so 2 questions. One, on the federal disbursement, are you expecting to have more data on how many people who have gotten their state benefits and have actually gotten payments are getting those federal funds too, and how are you getting those out? And to the doctors, or maybe to yourself, are you expecting that there will be some restrictions for employers when we do reopen about testing potentially sick employees, temperature, no contact temperature testing, things like that? And would those even help?
So, yes, the Federal CARES Act money is going out. We'll have the breakdown of that, but there's been at least $100 million in CARES Act money that's gone out, and so I think there'll be more this weekend as well. When they're processed on the weekend, I don't think they actually drop until the next business day because of the banks. But yeah, that's very important, and we're working hard on that. In terms of employers and how they're doing with the testing, one of the things we're going to be doing is actually having more test sites. Even though the test sites we have aren't at capacity, we're going to put one in different parts, put them in different parts of the state, with the understanding of, if you're an employer and you have an employee come in and maybe they have a cough or something, that they have an easy place to go. Now, we're not going to be the only game in town. You're going to have hospital systems, doctors' offices, but we think easy access to testing will help get the economy back going. In terms of doing temperature checks and stuff, I think that's good, but I think the doctors will tell you, not everyone that has COVID-19 has a fever. In fact, I think probably many of them don't have a fever. And so that in and of itself is probably not going to be enough. And the testing is also, some people say, hey, everyone should just get tested. Okay, well, say we tested everyone tomorrow. That doesn't mean that you can't get it 2 days from now. And so it's not like you have a negative test. It's not like you have antibodies because you have a negative test. And so it's going to need to be done in a strategic way that makes sense. But I'll let the doctors weigh in if they want to on what the testing would look like in terms of the economy.
Our advice to employers is behavior modification of employees. That's the most important thing. Testing comes and goes. Testing may or may not work today or tomorrow. But if you teach behavior modification, the first major one is make sure every employee, before they come into work, self-screens. Not just self-screens for the most common symptoms, but for all of those rare symptoms. So if you have any symptom at all, essentially you stay at home. That single behavior will save huge amount of transmission in the community. And the second behavior is don't touch your face. If you're an employee, just don't touch your face unless you have clean hands. Those kinds of behavior modifications are going to dwarf the testing and the antibody testing and all those other things in terms of importance going forward, and temperature checking.
Remind people what the symptoms are that they need to be checking for.
So the traditional symptoms would be fever, shortness of breath, dry cough, a sore throat, runny nose, nasal congestion, a loss of smell or taste. Those are recently added. GI symptoms like diarrhea, disequilibrium, just feeling unsteady on your feet, general weakness, and of course, if you've had a recent positive contact. I'd like to make one comment about the testing. I think somebody said this, but I want to stress again, testing means you're negative now. It doesn't mean what happens tomorrow. It doesn't mean what happens the day after. It doesn't mean, so the antibody tests, once we figure out what they actually mean, and is the immunity long lasting, we don't know how long it lasts, we don't know who will be immune, but the temperature checks do not rule out all of our interventions. You just have to be careful that we don't have an unintended consequence and give a false sense of security, so you stop doing the basic things that Dr. Hakeem just mentioned. It's incredibly important that vigilance doesn't change.
And some of the stuff in the workplace, we know that, for example, CDC's done studies with some of the data out of South Korea and stuff. If you're in a enclosed environment, in close contact, repeated, particularly over a number of a certain amount of time, you're just going to be more at risk for being infected if somebody else is infected that you're working with. There was a call center, I think, in South Korea where they had a bunch of people, but the people on the other floors didn't really get it. But almost everyone on this one floor because they were in the same room together, they were in cubicles over and over repeated. A lot of them got infected. And so you were able to do your workplace in a way where you're trying to minimize those close, repeated, sustained interactions. And when you're doing that, they have found success at reducing the number of infections. And so those are just things that we've kind of seen over and over again. I mean, you look at different parts of the country and some of the interactions, and you can see why they had greater outbreaks. And so these are going to be things. Just the fact that people are conscious of this is going to make a huge difference. And just they now understand where the behavior is more risky and where the behavior is going to be safer. So I gotta head back to Tallahassee because I've got to go. Excuse me. I've got to go back to Tallahassee. We're working on our task force. I hope to have some good announcements with the additional unemployment, some of the other stuff that we're thinking about the road ahead. But I do want to thank Orlando Health for all that they've done during this very trying period of time, and all that they're going to be doing as Central Florida gets back on its feet. So thank you, guys. Yep.
Governor, one question about the executive order. Department of Labor says people